Hello everybody. In this video we are going to see about faciomaxillary injuries. Now what are the injuries that come together in this particular topic? We have fractures of the jawbone, lower jaw called mandible. We have fractures of the upper jaw or the maxilla. We have fractures of the cheekbone or the zygoma. Fractures of the nasal bone. In an earlier video I had already talked about the nasal bone and I had shown the pictures. Now, in this particular video, we are going to discuss about the fractures of the upper and lower jaw. Now, what is the function of the jaw? The teeth that are present in the jaw. The function of the teeth is to masticate the food. It is to grind the food. It is to chew and masticate and grind the food that we eat, so that it is easily digestible after swallowing. Now, if the teeth are not in proper alignment, then that person will not be able to chew the food properly. When the lower jaw or the upper jaw is broken, the alignment of the teeth goes vary. So we have to bring the teeth into alignment. That is the first and foremost priority. We have to bring the teeth into alignment. We have to reduce the fracture and we have to fix it. Now, whenever there is a fracture of the long bone, say the arm or the leg or something like that, we can always go for a plaster of Paris cast or any ready-made cast or a splint, and then we can splint it and leave it for 4 to 6 weeks till the bone unites, and then we can remove it. But in the face, we cannot afford to do that. We cannot put a cast over the face. So what do? Here we do a plate fixation. We bring the fracture segments together, reduce the fracture, and we fix the fracture with the plate and screws. At the same time, we have to bring the teeth into occlusion. We have to bring the teeth into the correct position, in the position of occlusion. So what we do is we fix an arch bar, plate with hooks. We fix it with wires, and then we tie these arch bars together so that the teeth are brought together in the position of occlusion. And once the teeth are brought together in the position of occlusion, we fix the fragments with a plate and screw, and then we close the wound, and we leave it like that for about 3 to 4 weeks. And as long as the teeth are tied together, the patient will not be able to open his mouth, and he will be on liquid diet for that amount of time. And once the bone unites, we reopen the oral cavity, we release the intermaxillary fixation so that the patient is able to start taking food in a normal way because the bones have united. Now, in this particular example that I am showing, I am not showing you the actual raw pictures of the faciomaxillary injuries because they are quite gross. What I am showing you are only the 3-dimensional CTs, computerized tomogram films, pictures, 3-dimensional images of the skull and the bone, so that you are able to appreciate the extent of injury and how we have fixed. Now, in the preoperative picture, you will be able to see the extent of the fracture of the mandible, the upper jaw, the nasal bone, the cheekbone and all that. And in the postoperative picture, you will see that we have reduced the fracture and we have fixed the mandible with a plate and screw, and we have fixed the upper jaw and the zygoma with the wires, intraosseous wires. And we have brought it to satisfactory position related to the original position. So the bones heal properly and the function is not deranged. Function becomes normal. So this is what we do. So this is what we have shown here, preoperative and postoperative 3-dimensional CT films of the skull with the fracture and after treatment. With this, I think you will have a rough idea about what a faciomaxillary injury entails. I think you would have benefited from this video. Thank you very much for watching this video. We'll meet again. Thank you.